Ukinik Sukwax. Nistuana Kukiayo Tamasot. Barry turning over to Hill Chief of Abatsi Piikani. Today, Thursday, March 26, 2020, we would like to share another update to the ongoing crisis we Piikani are dealing with. As of today, we still do not have any positive cases of COVID-19 in our community. We thank those in the community that continue to practice social distancing and good hygienic practices. However, please be aware there are confirmed positive COVID-19 cases that are coming closer and closer to Piikani. As we have mentioned before, Agamfkayi Health Services is the primary healthcare provider during this emergency. All Piikani Nation members are asked to call Agamfkayi Health Services for any questions regarding medical health. Also, you can call to request for a risk assessment to determine your risk for contracting COVID-19. After this assessment, they will provide further direction for your next steps. The call center for Piikani Nation Essential Emergency Relief Packages registration officially opened yesterday, March 25th, 2020. Please call 403-965-3092 to register for your household emergency package. The hours of operation for the call center are Monday to Friday from 9 a.m. to 6 p.m. and on Saturday and Sunday from 12 p.m. until 5 p.m. The emergency supply packages are available to those who are on fixed incomes, which includes elders on pension and those individuals who are on income assistance, and age recipients. The schedule will continue for as long as access to resources and supplies remain available. Piikani Chief and Council want to thank the frontline workers for ensuring the safety of the public and making sure our people are receiving proper supplies. Protecting the health of Piikani Nation members and supporting them during the COVID-19 pandemic is the Piikani Chief and Council's highest priority. To help provide detailed updates, I have asked Agamfkayi Health Services to join us today and to provide an update of their own for the COVID-19 pandemic. We have also asked Piikani Resource Development Limited to join us to provide an update on the call center and registration process, along with the transportation coordinator for the Piikani Pandemic Relief Team. We will continue to provide important updates to the Piikani Nation members as information becomes available. The Piikani Nation has been and always will always remain resilient during unprecedented times. With collaborative efforts, we will always take care of our people. I would like to convey a message from our Piikani Nation Council. We would like to thank you for your continued support during this troubling time. We ask that you continue being diligent in protecting yourselves, your families, and our community. I also want to thank Dustin Wolf for his prayer this morning before we opened up our meeting. And with that, I want to introduce the representatives from Agamfkayi Health Services to provide an update, Piikani Resource Development Limited, and our transportation coordinator from the Piikani COVID-19 response team. Thank you very much.
Daamiksi naatini. Okei nikso koaksi sanakoka ninasokskini. Morning Nation members, Piikani Nation. My name is Dustin Wolf. I'm the health manager for Agamfkayi Health Services. Giving you an update this morning. As of this morning, there's been no confirmed positive cases on Piikani Nation. We're actively screening members within the nation. We're working closely with AHS and Blood Tribe every morning, having conference call with them and updating everybody to us what's happening with COVID-19. To ensure all is being done to support everyone and their loved ones. We're also doing all we can to ensure members are protected. In doing so, we have placed restrictions on daily activities of our members, and we're requesting that our members do the best to follow these guidelines. Remember, we're all in this together. Restrictions and supports in facilities. Knowing the increased risk of the elderly or chronically ill populations posed by COVID-19, we have put significant restrictions into place at all AHS health facilities, including the following. Each essential visitor must be verified and undergo a health screening prior to entering the facility. This may include a temperature check or a questionnaire. Facilities will have security staff or a greeter to conduct this screening and verify the visitor is designated. Staff who are ill are not permitted to work at any facility in any role until 10 days after the onset of symptoms, or after the symptoms have cleared, whichever comes later. Self-isolation guideline changes. Please make sure you and your loved ones are familiar with the new guidelines for self-isolation, which include the following. Stay home for a minimum of 10 days with any cold or flu symptoms until feeling well. If symptoms continue past 10 days, isolation should as well. Do not go out, even to a family doctor, emergency department, urgency care center, or clinic, without using the online assessment tool available at ahs.ca or calling 811. If you have life-threatening symptoms, go to the emergency department or call 911. Travelers must self-isolate for 14 days upon return, even when feeling fine. If symptoms are experienced during this period of isolation, you must continue to isolate for an additional 10 days following the onset of symptoms, no matter how long you've already been in self-isolation. Supporting mental wellness. There's no shortage of news about COVID-19, global pandemic, and some of it you need to know. Please ensure that you strike a healthy balance between consuming the news you need and not getting overwhelmed by it. If you need a mental health assistance, please reach out to the crisis line. Novel and unfamiliar threats provoke anxiety, unrealistic fear, and racism. Social distancing, effective communication, and public health measures are a realistic line of defense. You can take steps to manage your own stress. Limit media consumption, avoid discussions about the event. Remember that life goes on. Build your resilience. Keep connected. Keep things in perspective and have a plan. Testing protocols. There has been some changes made to protocols for testing for COVID-19 to allow us to focus on testing capacity on those most at risk. This change will allow us to increase testing of symptomatic healthcare workers, better enabling us to protect our teams, patients, clients, and the system as a whole. Testing will be done on individuals with symptoms in the following categories: people who are hospitalized with respiratory illness, residents of continuing care and other similar facilities, people who have returned from traveling outside of Canada between March 8th, March 12th, before the isolation protocols were in place.
Public health program recommendations are as follow. Routine immunizations are an important component of public health that protects individuals and our communities. At the present time, there is no confirmed cases of COVID-19 of Piikani Nation, and as resources, routine immunizations can continue. It is recommended that immunization service be scheduled rather than drop in the limited number of people in the health center. Social distancing. If resources are stretched in the community provision of routine public health immunization services, will need to be reassessed. If routine immunization services cannot continue, it will be prudent for programs to be triage immunization services requests and have a discussion with individual clients regarding their specific circumstances. Some immunization services will continue to be essential, such as RIG, TIG, tetanus, and diphtheria. All nurses in the community may be asked to follow the communicable disease cases, including COVID-19. Directions on any required follow-up will be provided by a communicable disease team. This may include contact tracing for COVID-19, following up on notified diseases, direct observation therapy for TB, and contact tracing for TB. Home care visits for newborns should be continued as newborns and moms require assessments following discharge from the hospital. It is recommended to call home and discuss how best to visit the newborn and mom with a preference at the health center if possible. We will also visit you at your house. If visits completed at home, we will ensure that all immunization and visits are done with precautions used. How can we prevent transmission of COVID-19 while providing the essential services in home? Prior to patient contact in home or another location, is a recommendation that the nurse completes a point of care risk assessment to determine the potential risks associated with providing care. Home care and community care program recommendation. At present, all home care community care programs are recommending essential services continue to offer to clients. Therefore, each client should undergo a review by the registered nurse and the care team to determine which activities of care and clients will continue to maintain their well-being and prevent clients from needing access to medical service elsewhere. For example, insulin-dependent diabetic that require assistance administering insulin and dressing changes to infected wound will be essential services, home support. Personal care and home spite may not be essential at this time.
Again, Nation members, remember to practice social distancing. Take care. You know, we're all in this together. You're not alone. Elders, if you have any questions or concerns, please contact Algonquin Health Services, 403-965-3809, and we'll have a translator there for you. Thank you.
Uki Piikani. My name is Katrina Shade, and I'm the manager for Piikani Resource Development. I would like to thank Chief Stan Greer and our Piikani Nation Council for this opportunity to provide an update to you Piikani Nation members. We at Piikani Resource Development have been working diligently assisting with the coordination of the emergency essential food packages. Our current role is to provide registration services for Piikani Nation members located on the reserve. Our call center went live yesterday and began taking calls from Piikani Nation members registering for the essential food packages. If you have not yet registered, please call 403-965-3092 to register your household. The call center will be accepting calls during the following hours: Monday to Friday, 9 a.m. to 6 p.m., Saturday and Sunday from 12 noon to 5 p.m. We ask all those calling, please be patient as we have a limited number of staff and we will get to all of you as soon as we can. We want to ensure you that we are providing you with basic food supplies that will keep your family fed during this global pandemic. However, this is an emergency service, so please remember that these items will need to be rationed properly to feed your family. The Essential Emergency Relief Package will contain items such as flour, oatmeal, rice, noodles, canned goods, fresh produce, and basic toiletries. Just a reminder, when you call the call center, your call will be forwarded to an intake person where a member will ask you a series of questions that will confirm your eligibility. Given the information you provided, your households will be inserted into one of our predetermined zones based on your location on the Piikani Nation. Our intake person will communicate with you a date you can expect your emergency relief package. Please remember that the packages cannot be picked up in order to ensure that we are keeping everyone safe. We want to remind you that these emergency supply packages will be available on a weekly basis, although you must wait 1 day after receiving your package to call the call center and re-register for the following week. During the call to register your household, the following types of questions will be asked: name and the head of the household, mailing and physical address, land description that can be found on your gas or electricity bills, your contact information, including email address and phone numbers, how many members in the household and their ages, if they have any dietary requirements, restrictions, allergies, and any other special requirements such as diapers for children, formula, wipes.
Okay, ni Taniko, what's going on? So just giving an update on how the delivery service is going to pan out on these food packages. So please remember there will be no contact with the delivery team. They will beep their horn to notify you that your package has been delivered and you may retrieve it. We would also like your support and assistance during the delivery of your package. If your house has any dogs that may pose a threat to the safety of our delivery staff, we ask that you take all the steps required to control your dog during the delivery. Our delivery staff will take all measures required to protect themselves. If an animal appears to be unfriendly or protective of its home, the delivery will simply not take place. The driver and delivery staff will remove themselves from the area to a safe location. Delivery schedule. The Piikani Nation has been divided into zones to facilitate the delivery of emergency essential packages. Zone 1, Townside East. Zone 2, Townside West. Zone 3, North Side, also known as across the river. Zone 4, East End of the Reserve. Zone 5, South Side of the Reserve. Preliminary delivery times are as follows. Zone 1 will take place on Monday, March 30th, 2020. Zone 2 will take place on Monday, March 30th, 2020. Zone 3 will take place on Tuesday, March 31st, 2020. Zone 4 will take place on Wednesday, April 1st, 2020. Zone 5 will take place on Thursday, April 2nd, 2020. Please ensure you are home on the delivery date. And also at this time, on behalf of the relief team, I would like to thank our leadership and all of our team members that are doing their best, that are working around the clock to ensure that our Piikani members are getting these essential packages. And I would also like to thank you for your patience